Hey everyone, it's Vanessa Callahan, and I'm so excited to welcome you to the Calm, Empowered Parent podcast. Together, let's challenge the idea that parenting has to be perfect. We know that there is no one-size-fits-all approach to raising children, and while love is the key, it sure helps to have the right tools for the job. Raising resilient humans is intensely personal and even transformative work, and I'm here for it. Let's laugh, cry, heal, and learn together. Here we go. Hi and welcome. I am so thrilled to have two esteemed professionals in my midst, folks that I have had conversations with about student assessments, really looking at how to support families as they're navigating what can sometimes be an overwhelming, confusing, and complicated process. And so it's my great pleasure to introduce Dr. Jessica Patel and also Erin Crawford, professionals here in the Bay Area that have their wisdom to share with you today. And both of my guests are also parents, they're mothers, and both of them share a passion about helping families navigate assessments and get to the bottom of their children's true difficulties so they can support them and advocate for them. So just give you both a chance to say hello.
Hi.
Hi, thank you for having us.
And I just want to maybe tell you a little bit more of their background. So Dr. Jessica Patel, she's a licensed child psychologist with over 20 years of experience in comprehensive evaluations. And during her professional career, she created and ran a global assessment center, allowing her to bring a global and comprehensive approach to understanding and supporting the unique developmental needs of each and every child. And she currently owns a private practice and also works at a major local hospital here in the Bay Area and focuses primarily on comprehensive neuropsych evaluations. And what I like about that is that her approach helps a lot of families who have maybe partial evaluations to fill in the blanks and have a fuller picture, or maybe to confirm a diagnosis when they're not feeling it's like quite thorough, and much more. And we're going to be leaning on her expertise today, as well as Erin Crawford, who is a licensed educational psychologist. She has a background in psychology, sociology, and earned a master's in school psychology from St. Mary's College. And with her 16 years in the field, she served in many different capacities to school districts, including in Marin, Sonoma, Contra Costa, and 7 years in Newton, Massachusetts. She's back here in the Bay Area, done with those winters, right, Erin?
Yeah.
And she's, I feel you, I'm from Detroit, so, you know, it's great to visit, hard to move back.
Definitely.
And she's part of a team called Empowered Ed Psychological Services based in Marin County. And she focuses her work on psychoeducational student assessments, where kids who are underperforming in school need assessments and some advocacy so that they can access the services they need and that, quite frankly, they deserve. So got some heavy hitters for you today. Really excited to get into this topic. And we had more questions come in from listeners than on any other topic so far on the podcast. So just goes to show how timely this topic is as we kick off the school year, as folks are maybe navigating through a few months of the school year, wherever you are, you know, in the school year listening to this and coming across these questions, we're here for you. So I want to just get a sense though about your inspiration. So I'm starting with Jessica, like why focus your work on assessments? You know, like what inspires you to focus on this and not on other avenues of student support? I'd love to hear, you know, about what got you into it.
Yeah, absolutely. So it definitely was, you know, just kind of as I was exploring different avenues and figuring out what I wanted to do. Actually, I initially thought I wanted to be a lawyer, and then got kind of, obviously I'm not, and then I got more into some advocacy work just on the side with volunteering. I took a lot of like psychology in the law classes. I really like that like investigative and kind of fact finding piece of things. And then I realized to be like a true forensic psychologist, like we were watching in the movies, that I have to join the FBI. And that is definitely not me or my jam. I have a lot of respect for it, but definitely does not play to my strengths in any sort of way. But I really like that investigative aspect of things. And a lot of my early work was actually in foster care and in juvenile justice. And I actually have a master's degree in child law as well. So I did kind of bring that flavor into it. And as I was working with kids and just getting experience and working with them through therapy and working in schools and in a lot of different ways, including evaluations, what I kept seeing is kids being very misunderstood. us not looking at the whole picture of their life circumstances and having a really good lens as to why they might be having some difficulties in school or why they might be having some behavioral dysregulation. And so a lot of kids completely mislabeled, and there's been a lot of research about that, of PTSD being misdiagnosed as ADHD, and the treatments are very different and the understanding is very different. And so I really started getting heavily involved in evaluations, just more from kind of an advocacy standpoint, to make sure that we really understood these kiddos who were very underserved and very kind of overlooked part of society. A lot of that work was done in Chicago, a little bit in Florida. So I also experienced that cold weather too. And then I actually moved to rural Illinois, and I was doing more in the teaching realm and a little bit of advocacy work there. And they had no psychologists doing evaluations. And so people in this rural community were traveling between 2.5 to 5.5 hours to get evaluations done or any sort of diagnosis. And actually, when I moved into the community and people found out that I had this background in evaluations, and of course I had no idea that that was the need, they started meeting with me and talking to me. And then that's where, with the team, we created a global evaluation center, assessment center, to really, kind of try to meet the needs of kids and family. And that was wonderful. It was multidisciplinary. And again, bringing in that different lens for how we view and work with kids, and just really trying to empower the kids and families. And then when I moved to the Bay Area, I just really wanted to continue that work.
Yeah, and it seems like you've worked with so many different populations, so your perspective is like must be so well-rounded, getting a sense of like what contributing factors are really in play. So that holistic approach really carried through. And I can see you diving in with the forensic side, like just investigatively. Let's get to the actual bottom of this and get the full picture. So what a great fit for your talents and your background.
Thank you. I love it.
We'd love to hear from you too, Erin. Like what helped you, decide to focus here? I mean, I know that like you said, you've served in many different capacities in schools. What was it about student assessments that really fired you up?
Yeah, I was listening to Jessica's answer, and I was kind of smiling to myself because I also thought I wanted to be a lawyer when I was an undergraduate. I'm very glad I did not go to law school. That was not the path for me. But I've always had an interest in and a passion for psychology. And, I considered doing more of a therapy role. And I discovered the profession of school psychology was a nice fit for me. I come from a family of educators. I have lots of relatives. My sister's an educator. I have a passion for education, and I dabble a little bit in being a teacher myself, again, trying to figure out what fit best. I found it a little bit exhausting standing up in front of a classroom all day, and I'm not a super extrovert, so I found it very, very taxing. So finding school psychology was really kind of a nice way to marry my interest in children, in school systems and education, and also psychology. And what's nice about that field is you really get a breadth of experience and knowledge because school psychologists do a lot of different roles within a school. Assessment is one of those roles, but they also do consultation, they do behavior management. They wear a lot of hats. And I think starting my career as a school psychologist gave me exposure to so many different types of skills and experiences, working with families, working with administrators, working with students, obviously. And it's very rewarding. Unfortunately, the current state of the profession, there is a national shortage of school psychologists. So the demands on the profession are just increasing in terms of what a person is expected to take on every day. And it's a lot. And I found myself not being able to do as thorough of an assessment as I would like because just the sheer volume. The numbers vary, but if you're doing maybe 200 assessments in 10 months, you obviously can't do the breadth and depth that you would like to, and that would be most beneficial for a student. And you're also being pulled in a lot of different directions. If a student makes a statement to their teacher or another staff member that they might want to harm themselves, obviously testing gets put to the side, and that is what needs to take your attention in that moment. So I just found that being pulled in so many different directions, I wasn't able to do the quality of assessments that I really wanted to do and that I think students really deserve. So I kind of shifted to a private practice role, which allows me to go as deep, as wide. I like to kind of encircle a student. I want to talk to their parents. I want to talk to if they work with a psychotherapist, if they work with a tutor, if they work with an executive functioning coach, and just having more bandwidth, I can do a better assessment. So, I've really found more fulfillment professionally in being able to go deeper and wider because I have fewer students I'm working with. I just think I could do a better job.
And we have to give a shout out to all the school counselors out there who are still taking on those caseloads. A lot of health practitioners, nurses in ER rooms through COVID, just who are kind of our warriors out there. But the burnout is real.
Yep.
And it's really important also for those same practitioners to raise their hand to say, I'm ready to tag out when it's time to tag out. So I commend you for knowing when, it was the right time and to step into something that also for you was more fulfilling because you were able to serve the kids even better.
Definitely.
So yeah, powerful stuff. And we're here to learn more about like how assessments work, when and why they are needed, and to answer some specific listener questions. And we're about to dive into that. I guess I want to hear from each of you just briefly, starting with Erin, like, why do you think there's such an interest in this conversation? I mean, I think you just touched on it. I think people are finding that school services are doing the best they can, but they're maybe not getting to the heart of things because of the caseload. But I guess, why is this conversation more important than ever? Why do you think listeners are really digging into this question about assessments? What do you think is going on?
Yeah, I think just as a society, we're becoming more knowledgeable about neurodivergence. I don't know if that's, a term that folks have heard, but I think it's becoming more of a commonplace idea that all of our brains are different, and that's beautiful. And there's more research coming out about different presentations of different types of learning disabilities, of autism, of ADHD. And I think, it's our job as parents to make sure that we understand our children and that they have the tools they need to be successful, whether that's at school or in their social lives or in society. And I think more and more parents are hearing different terms, autism spectrum disorder, dyslexia. And when they hear feedback from teachers that your child might be a little bit behind in, a particular academic area, or they're struggling to focus, or maybe their social relationships aren't as strong as they could or should be, or, we're noticing unusual behaviors, parents just want answers. They want to know what's going on with their child so they can address if there's an issue. And I think that's our job as parents. I'm a parent. We talked about it earlier. That's all we want for our kids, is to know if there is an issue, and if there is, what we can do to support them. So I think that's just parenting 101. So
Yeah.
I think that's kind of the core of it. Every time a parent calls me, they're just looking for answers. And if, an assessment does yield some sort of diagnosis or area of concern, they want to know what to do about it. And I think that's the fundamental core of why we get phone calls.
I really like how parents are becoming more hip and savvy to the possibility that like there are specific services, specific approaches, specific even like parenting approaches that could make a difference and make an impact, and that they're willing to go into that uncharted territory that maybe they are very unfamiliar with, terms they've never heard of before. They're just hearing for the first time. Wade in there. I mean, it takes some courage. So I imagine a lot of those phone calls aren't easy for people to make when they make them. And I agree, it's parenting 101, but it's also sort of like this breakthrough that we're having, that this is now included in the baseline of parenting. And I just applaud all the parents who are taking that tough look at what's going on and willing to do that. I still remember early in my teaching career where even we were kind of skirting around even using any language that could suggest a diagnosis. I've seen a shift in the last, especially like 6 to 8 years. And I wonder, Dr. Jessica, like, what have you seen too, having been in the field as long as you have, like Erin, what are you seeing here? Like, why is this more important than ever?
Yeah, I do. I have definitely seen a shift. So I think, even in the last, as you said, like 6 to 8 years, although, I always lose sense of time, especially with having 4 little kiddos, about like, how long has it been? But I totally agree that it's kind of this, I think, access to information. So you have everything from TikTok and social media to just podcasts, or being able to get so much data and hear so many terms that you may not have ever heard before just because it wasn't kind of in your world. And I think there's a lot more openness to these discussions about just general mental health, development, and even parenting. Like that wasn't even the forefront of discussion of how, hey, guess what? I have 4 kids. I have to parent them differently. They're all 4 very individual human beings. Whereas even when I went to school, it was definitely like, here's what you do with kids, and this should work for everyone. So I think everyone is really starting to recognize that neurodivergence and brains work differently. And that's what makes the world a really cool place. And I am seeing a shift even in terms of how people are kind of seeking out those evaluations. So sometimes there is a very specific, question that they're looking to get answered, or, schools or someone has mentioned some sort of difference that they're noticing. And then I am also seeing, which is, I think, much newer, is kind of like, hey, is my child neurodivergent? I don't know. Or wait, I just want to learn more about their strengths, or how can I help to support them? And that is beautiful that people are willing to recognize that. So I think it's really this like increased access to information and just more openness. And even our understanding of things, as kind of Erin was saying, has shifted over time, which I think people, it's just kind of a new way of thinking about things, which has really helped people who may not have sought out evaluations before realize like, hey, this can be really helpful. I mean, theoretically, this would be great if everyone had this as a baseline. I know that's not accessible or anything like that, but you do find out really great information that can just be so helpful.
Yeah, I appreciate your perspective on that. I have similar feelings. I just think it's just like a standard like process of like, at the very least, like learning styles and some basic measures. And then, for those that we see there's even more nuance we need to explore, we have like, level 2, level 3, level 4 testing or something, and having that be standardized is like the dream. And I guess, I kind of want to go back a little bit where, for folks who maybe are just starting to come to this topic and, to this query of like, would an assessment be useful for my child? How do they work? What are a few things that you wish you knew sooner about assessments, or that you wish, like you can imagine these parents in their situation, like, what are some of the first things that you want folks to know about assessments that you think are like the most important sort of understanding? Because I think there's a lot of misunderstanding out there that you need to wait until you're in crisis, but I don't want to go much I want to hear from you, but that's my hunch is like one of the things. But why don't we hear from you first, Jessica? Dr. Jessica, give us your perspective on this.
I mean, really, I think that evaluations can be really beneficial at any point in time. And kind of the decision making, of course, is going to depend. And I hate to say that, but it's going to depend on a lot of factors. It's going to depend on everything from like the reality of life, like finances and schedule, and how it's just going to fit into your current situation. But I think one misunderstanding that happens a lot is that people, like you said, think they need to be in crisis, or they worry that the evaluation is going to be viewed negatively by their child. And really, of course, there might be things that kids don't like to do during the evaluation. Like if they really don't like writing and I'm asking them to do a lot of writing, of course, I'm using my tricks and tools and breaking it up and trying to make it fun. That might not be their favorite thing, but in general, I try to make it a very positive and affirming and empowering experience. Kids I have a prize box that even teenagers like, and just this interaction and kind of the way we talk to kids and present it to children makes a huge difference. And so it can be this very positive, affirming experience. And for some people, if you have the resources to get it done and you're even just like, wait, I'm kind of questioning something, or I just want to know about my kid, and you have the access, that's wonderful. You're always going to get good information. It doesn't mean you have to be focused on a specific diagnosis. And so it just really can kind of vary. And so I think that kind of understanding that this is actually usually, our goal as psychologists is this to be a positive and affirming experience, and to have kids learn more about themselves too. Because if they are feeling any sort of area of difference, they're already internalizing that and have their own monologue about what's going on. And no matter what we tell them that we find out from the evaluation, it's going to be more positive than what they're already feeling. And so I think really having that outlook that should not be a stressful experience. It should be a good experience for your child, and you should feel very empowered walking away, and so should they, can take some of that fear or kind of feeling like they need to wait until, something bigger happens kind of off the table.
Thank you. Erin, what would you say you would want to make sure that folks understood or that you wish you understood sooner, you think would help people along?
I think that the process itself produces a lot of anxiety in parents because they don't know what it entails. So I think, just in initial phone calls and intake calls, I think it goes a long way to explain the process. We're going to be doing various activities. I'm going to be asking your child questions about their interests and their friends and their family, how they feel about school. It's very intentional, the sequence that I use. We want to establish rapport with the child. We want them to feel comfortable. We're not going to get the best data if a child feels nervous or scared or overwhelmed. My office is filled with games, toys, fidgets. I also have a prize box.
Mhm.
We as psychologists have all these little tricks up our sleeves, taking breaks, playing games, making sure that the child feels comfortable is sort of step one. You're not going to get good data if they don't feel comfortable. I agree that having that information, I think that's why my company is called Empowered Psychological Services. I think it's empowering to know about yourself, and that includes your brain. And, whenever I do feedback sessions, I encourage students to join because I think it's powerful to know about your strengths and weaknesses. I always tell students if, they're in the feedback session, if I gave these tests to anyone, to your mom, to your dad, if I took the test, we're all going to have strengths and weaknesses, and that's what makes us interesting and fun and different. No one's good at everything, and that is not the goal. The goal is to understand the things that are, a little bit easier for you, and the things that are more challenging. What can we do to make school or life more accessible and not so stressful, and remove barriers? So I think just demystifying the process to parents definitely helps them feel more comfortable. Obviously, we don't let parents into the testing session because that would, break standardization, and then you wouldn't have great data. But they're always welcome to sit right outside the door if there's ever an issue, if a child is upset or needs a break, or sometimes we say, today's not the day, and that's okay. You have to be flexible. They're kids, they're not robots. And, just making sure that everyone feels comfortable. During the first session, I usually invite the parent in and we have a nice conversation. And I try to gauge when the child feels ready to separate from their parent. And if that doesn't happen, that's okay. Then we reschedule. But I am also a parent. I would not want to put my own child in a situation where I'm not able to kind of ease them into a new and scary environment and ask them to do things that are new or different or sometimes challenging. So,
Yeah.
making sure a parent knows what the process looks like and helps kind of pass, and it depends on the age of a child. Obviously, a teenager is not going to have as much challenge transitioning from their parent, but younger children, it's easier when mom or dad are sitting next to them and we're talking and how was your weekend and what are you doing this afternoon, and just getting everyone kind of acclimated, I think can go a long way to build trust and comfort.
In our world, we always say, connect before direct, connect before correct, connect before
Mhm.
like connect first. It's not connect only though, because we still have an agenda. We still need
Right.
boundaries and things, that routines we're moving the kids through. But connection first really does make a difference. And I hear how you're both setting the stage for that potential, and not only for the kids, but for the parents, so that they, understand what the process is. They can feel more comfortable actually, moving through the steps with each of you. What a attuned process that you both have created. I love it. And who doesn't like a prize box? Even I want a sticker.
I know.
Yeah.
My own children, I have them pick out fidgets that they would like, and then they get some, but then they go in the prize box too because it needs to be motivating.
It's so cute. I love it. Yeah, I know. And like, it's like how human we are. And, we just can all, I think, relate to that feeling of like, oh, this is something that's friendly. And like you said, affirming, empowering. Those are some of the words that stood out to me. And we're going to shift to some listener questions. And I think through this, we're going to illuminate a lot of like sort of nuances, do's, don'ts, things that folks should be looking out for. And I do want to acknowledge something that both of you mentioned is like when it makes sense for your family, and also that, resources are limited, and they're limited more for some than others. That doesn't mean though that because family has limited resources, they won't prioritize this. Like even in my own
Right.
services, I have a year-long program. We have scholarships for those who qualify, but we also have folks who step up and say, this is just my priority this year. So instead of these other things, I'm spending it on this. And so I don't want it to tie together that if you feel like you're from a lower socioeconomic class and or you have limited resources, that means that this has to be a lower priority. Families do shuffle it. I also have seen folks that have, plenty of means, but maybe their bandwidth is limited, and that they're going to, even though the money's sitting there in the bank account, they don't have to make any shuffles or sacrifices to make it happen. There's just a bandwidth issue. They need to clear up some things. And, these are all things that we're wanting to keep in mind as we go forward. And I just wanted to name those things before we get started.
I know we're in the Bay Area, where a lot of evaluations are private pay, but I know you have listeners from all over, and that is not the case in all areas. And so they can definitely, there are even major cities where the majority are more insurance-based or things like that. And so again, you don't kind of know what that is going to look like, even from a financial standpoint for your family, until you look at the nearby resources as well too. And also, if parents reach out and they decide it's not the right time for their family for whatever reason, don't be afraid to reach out again. I have many families not do it and then maybe contact me a year later. And sometimes you can tell the hesitation of like, hey, we didn't do this before, but I really want to do it now. That's great. That means that this is a better time for your family to do it. And that's when we want you to do it. So don't be afraid to reach back out or to ask more questions or any of those things until you feel comfortable that you are making the best decision for your family and have found the best fit for a provider as well.
Yeah. So this is some good general ideas. And then now let's get into the nuances of some of the specific questions. So Kat Gutierrez from San Francisco has a 2-year-old, 9-month girl and a 5-year-old boy. And she asks, my daughter seems to have difficulty getting her words out, so it starts to sound like a stutter. When should I get nervous about this? And what can I say to my daughter to help her? When should there be an evaluation? So I'll just actually open up to either of you, whoever would like to take this first.
I don't know, Jessica, if you want to jump in. I think probably our brains are both going to a similar place as, that sounds like a speech difficulty. And there are professionals, speech language pathologists, that really specialize in kind of all different aspects of language, whether it's receptive language, like can children understand what's being said to them, the language that they're receiving from others. There's expressive communication. Can, they articulate their ideas and what they're trying to say and what they know. There's also speech and language pathologists evaluate the quality of speech, which is what it sounds like this parent is concerned about. So things like articulation, stuttering, lisps. And they also look at something called social pragmatics. So how do children use language to connect and communicate and get their needs met? So I do evaluate language, but I would say that's not my area of expertise. That's really something that a speech and language pathologist would be able to take a look at and provide like support for, like oral motor exercises to help if there really is, something physically happening with her mouth and her tongue. There are professionals that would be able to help do exercises and support that development. So that would be my recommendation. I don't know what Jessica would add.
Yeah, I completely agree with you, Erin. This definitely falls into the realm of more of a speech and language therapy evaluation, and even kind of deciding when to do that. I think it depends on how much it's bothering her and how much it's also worrying you, because sometimes if our mental energy, we're like, oh, is this impacting her, and we're worrying about it, it's definitely worth kind of just getting a quick speech and language therapy evaluation, which again, they're very play-based and engaging to see, hey, can they give me strategies to help with this? There are also times developmentally, again, I have 4 of my own kids. Kids are tricky. So sometimes this will happen for a very short period of time and you never hear it happen again. And so you kind of have to use your judgment on the frequency, the impact, how you're feeling about it to make that decision. But then my next step would be, consulting with a speech and language pathologist to just have them look at the fluency.
Thank you. And I'm curious, there's one more question in there where she said, what can I say to my daughter to help her in the meantime? And I'm thinking to myself, what I've seen work well, again, also not my area of expertise, but having worked with kids across about 20 years now, and many of those years with the little ones. And oftentimes, if you can get a sense of what they're trying to say, you can give them a little, ease their burden a little bit by saying, are you trying to let me know that you'd like this? And then you can kind of see very visibly, usually, if they have a sense of relief, that you got the words together for them. And what I often will say after that is like, why don't we try saying, and maybe the shortest version of that just as a start, like 1 word, 2 words, 3 words, maybe 5, most 5. And that can kind of create a little bit more of that communication. So there's less frustration if it is building into frustration. Otherwise, though, we don't want to take away their practice and their reps of trying through these words. So we're not going to want to apply this across every single moment that she struggles. Give her space to try things through too. So there's a balance to strike there. But I think especially if the frustration seems to be happening, there's tension around it. Some signs of that is the kid gives up. They'll make a grunting sound or like kind of do that exasperate. I mean, we can all relate to feeling exasperated when you can't think of what you want to say and go, oh, or whatever, go, make a sound or just say, or like kind of like wave it away. I've seen little kids go, or stomp or like shake, So if you're starting to see that tension building up, then that might be the time to go in and say, oh, are you trying to let me know this? Are you trying to share this or say this? Yeah. And that can be really helpful.
I experienced that with one of my children, some articulation errors, and we didn't feel the need to intervene or do an assessment or any sort of support until it became frustrating for her. She'd say something and we'd say, what? And she would get fed up with repeating herself, which is understandable. So it was at that point we thought, okay, this is clearly frustrating her and irritating her because we keep saying, what? So, and even just having that assessment helped us understand even the developmental trajectory of different sounds. Some sounds you develop earlier, some sounds you develop later. And you just get so much more information about, okay, well, when should we expect her to have mastered these sounds? Is she late on that? Is she kind of within the zone we would expect? And if not, these folks have incredible training expertise on how to intervene to give her the practice and how to position her mouth. And her speech pathologist gave us kind of tips and tricks at home to say, okay, for this sound, you use this part of your mouth, or remember this little trick. And it made a difference. And you can see once children have the appropriate accommodations and supports and interventions, she didn't need speech therapy after a year. It was just so powerful to see in your own children and family, like, if they get an accurate assessment, we use appropriate interventions, it solves the problem. And now we don't say what, and she's so much happier.
Absolutely. I like the idea too. I've heard replacing the phrase with, I'm listening. Can you try again? I'm listening. It's like we're still communicating here. I'm still here. And that can sometimes be helpful as like, especially if you're, just getting started with the speech therapy and there's still a ways to go. I'm going to move on to the next question, which is from Sonia. So Sonia asks from San Pablo, California, with kids ages 4 and 14, when is it appropriate to have the assessments done? Are there particular assessments that tend to provide more accurate results than others? Please explain. And I wonder, maybe Jessica, Dr. Jessica, if you wouldn't mind helping us with this one first.
Yeah, I mean, I think if you feel that your child is struggling and you're noticing that with them, that is the time to seek out the evaluation, whether you're starting with school or you're seeking out an external evaluation, because really identifying why they're struggling. And what I found, even as being a parent myself, is we can identify that they're getting frustrated in some of the areas of struggle, but we don't always know the exact cause of that struggle. And if we know the causes, and also if we can identify strengths, so we know how to kind of help them manage the struggles, that can actually put us on a totally different path in terms of knowing how to support them at school, outside of school, in the home, other services, have them understand themselves. Like, hey, I know, let's use autism as an example, like, hey, the reason why we have a label of autism is because there's so many individuals whose brains kind of work in this way. And that's actually a really cool and empowering thing. And so that can actually be wonderful for kids to kind of figure out and say like, oh, wow, maybe I do have a few struggles. Here's why. And because we have a label and can put a name to it, now we know what to do to make things go easier or to help me feel less frustrated. And so if you're at that point where you're seeing a lot of differences with peers and you're noticing some frustration or some struggles, that would be the point where I would really consider seeking out that evaluation. And also it's just going to help you really target services. Because, okay, well, if therapy is going to be helpful, what kind of therapy? What should some of the goals look like? Who might be a good fit for that person? What could school be doing? What can we be doing at home? And all of that is going to really depend on the evaluation.
Thank you, Jessica. And, part two of the question was about the particular assessments. So she asks, are there particular assessments that tend to provide more accurate results than others? Please explain. And Erin, maybe you can get us started on this one this time.
Yeah, I guess the way that psychologists that do assessments kind of approach them is really based on the referral question. So obviously there's so many domains of functioning that human beings have. I think the type of assessment, the provider that would be most appropriate in order to conduct an assessment depends on what the issue is. If there's a medical issue, obviously you'd want to be seeking out your primary care and MD. If there are behavioral issues, there are different types of assessments to look at that, looking at the function of the behavior. If there are learning challenges, that's something that I do a lot of assessments, not necessarily with 4-year-olds. I can look at 4-year-old development and, typically what types of skills should be acquired by that age. I'm not looking at their reading skills because 4-year-olds aren't reading. But and like we talked about in the last question, if there's concerns about speech or language, if there's balance or motor concerns, whether it's fine motor or gross motor, I would probably refer someone to an occupational therapist. So I think knowing what the concerns are, what the issues are, would really help us know if that's something that kind of falls in our purview: attention, learning, memory, things like that. If it's more physical or medical, obviously there's other professionals out there that are better equipped to get those types of answers. So I'd probably need to know more about what the issue is to know who the most appropriate professional would be to do an assessment.
Okay, I was just going to say with that too, as part of that, initial call or intake process is really important for making sure that the evaluation will cover what you want them to cover, because sometimes it is more of a comprehensive evaluation. Sometimes it is more focused on one area, or sometimes you might be calling about, the stutter we talked about before, and that professionals should be able to then refer you to speech or OT, or say, hey, maybe you should start with school. And so making sure that the provider kind of has that conversation as to directing you to the right place, and really making sure you understand their services. And if it is or is not a good fit, it's just going to be such a critical component of the process to make sure that you are getting all of your questions answered.
Thank you. Yeah, and Andrea also had a question that was similar from Elsa Bronte, California. This is for a 9-year-old. She says that her child has a history of significant sensory sensitivities and even some rigidity. And they've been thinking about getting an assessment, and particularly because he seems to be struggling in ways that seem beyond his same age peers. And so a similar question of when should I have my child tested for learning challenges, autism, and or ADHD? And I think we've just addressed it, but I wonder if it's any different for a 9-year-old.
No, I think it's the same. I think for a 9-year-old, especially because, obviously he's going to be very well established at school. They probably have tried, at least some supports at home in different ways, and are finding that their toolbox just isn't working for their child. They may have tried some other supports. That would be at the time when I would say, I would explore the evaluation options for you to get some of those answers at that point.
Yeah, I would agree. And, I think sensory sensitivity is a common characteristic of people on the autism spectrum. It's also a characteristic of some other things. So I think just knowing what you're dealing with and clarifying, obviously that probably for Jessica and I opens up a million other questions, in what settings,
Yeah.
what type of touch, is it sound, is it smell? So that is kind of a jumping off point, I think, for someone in our role to understand more what types of sensory sensitivities in what situations. Is this a new behavior? Is this a longstanding issue? But I don't see many disadvantages to getting those answers. I think having more information is always more advantageous than having less information, even if it's just to rule things out, even if it helps a parent understand their child does or does not have a certain disorder, then you can have, a better plan on how to proceed and what is and what isn't needed to support your child.
I recently had 3 different people say to me, and I'm sure you've heard this too, I definitely don't wish that I waited longer. And I was
That's a good way to put it.
Yeah, I confirmed with a few other coaches, and never have I ever heard someone say, I wish I'd waited longer. And I think that's there's something telling about that. I mean, I think some exceptions might be early intervention, trying to get to a final diagnosis, and kind of boxing it in before they're even 3 years old. I think sometimes, there is a wait and see, like, let's wait for the next and reevaluate. And that's why we reevaluate, right? As they go through the planes. But I hear, like, with a 9-year-old, yeah, they're really, it's hard to think of a disadvantage to having more information. I do, though, want to ask you a question, which is, what are some of the stigmas that people might be carrying forward from maybe how we were raised, what we've been exposed to, or like what fears and stigmas do people have around getting assessed? I mean, Jessica, I think you mentioned one earlier, but I think it's a good moment to, like, restate and maybe even debunk some of the myths and stigmas around assessments and diagnoses. And I'd love to hear from you, Jessica, on this, since you've kind of started us off earlier.
Yeah. Well, and I think, things really have changed. So kind of like what we discussed before is, I think people think of kids coming in, actually, and my own child has been evaluated as well, but I know what to expect from the process, and I understand the anxiety, even fully getting it from the parent standpoint. But I think kind of what some of them envision is, like, they're coming into this room, we're going to be putting a lot of pressure on them, it's going to be a stressful experience, and it really isn't. It's very, it should be very engaging and have them feel very empowered and just great at the end of the session. And by the end of the evaluation, again, have some really good information. I think the one thing that we are getting a lot better about, but I think we still kind of have some of these internal things about, like, well, I was exactly like this as a child and I'm fine and I dealt with it too. And it's like, that may be true, but don't all of us want our children to have an easier path than we did, or maybe understand themselves more? And there's a lot more resources out there. There's a lot more acceptance. So that's another thing that I still hear coming up. And another huge one is just, I don't want my child to be labeled. I would say a significant amount of people who contact me, that is their hesitation. And what I say to them is, your child is already labeling themselves, and other people also may be labeling your child, but they're not giving them a correct, or usually a very positive or empowering label. So I see so many kids who are labeled with, like, oppositional defiant disorder, which is not a diagnosis I would ever use, because there's a reason behind any sort of dysregulation or defiant behavior. Or I'll see kids who are feeling really, they're using their own words of stupid, or parents might be thinking, like, oh, they're just not trying hard enough. Like, there's these external pieces that are going on that are actually not accurate. And then can create a lot of anxiety, a lot of depression and there's actually been a lot of research with undiagnosed things like autism or ADHD, and looking at long-term studies, there's higher rates of anxiety and depression because they just they feel different, but aren't really quite sure why. And so again, even if you're scared of that label, even if there may not even be a label or a diagnosis, but if there is, it's going to be done in a much more empowering way than whatever their kind of current schema may be. And again, that's different for everyone, but that is one of the big fears that I hear.
Thank you. Yeah. And I've been noticing this trend too. And that it's really different from maybe in the 80s and 90s or even 2000s, early 2000s. Even as an educator, I've seen the trend move towards this. One thought I have to add is that for a lot of things, even like that the child was donor conceived, that they're adopted, that they are, maybe were misgendered and they're, now expressing a different gender, and helping them navigate that. And I was like, where do you want them to hear it from first?
Yeah.
And having the opportunity to curate and be the first sort of voice in helping them unpack and understand, and maybe even grieve, and maybe even celebrate and embrace, and just all the different things, that stages of kind of coming to understand yourself more with something that can bring up mixed kind of emotions and reactions. And I think when we can get accuracy, and then we have the context of hopefully the unconditional love of the family being at the center of who's going to hold this label or this diagnosis or this sort of truth about them, then that's a very powerful thing. I think they also feel more seen, heard, and understood, and connected to their family members. That's what we experience in my family. Myself, my ex's ex-partner, so the parents, basically the three parents of my stepson, when he had his diagnosis, it was so important that we were all there for the results, and that we were all aligning around the language we were going to use and how we were going to roll it out to him. All that coordination really paid off. And he turned into that kid who would march up to his professors freshman year and say, hey, so I'm someone who needs to sit in front and ask a lot of questions. Is that going to be a problem? And most of the professors said, no, thank you for telling me. One of them said, you might need to find another section. That's not my lecture style. Let me help you find a better fit. And there he went off into college, like advocating for himself, having had his diagnosis at 11. So there's a lot of merits to kind of coming around the corner of these doubts, fears, and stigmas, and really being able to be at the center of the conversation with your child and for your child. So I love everything you're saying. Erin, is there anything you'd like to add to this one? It's a powerful one.
Yeah, I think what Jessica said about parents feeling guilt or, blame for a child's diagnosis or difficulty, I think is very powerful. I've sat in a lot of meetings where parents feel shame that, oh, if a lot of these disorders have a strong genetic component, autism, for example. And, I've seen parents feel like this is my fault. I've had parents cry, and it breaks my heart because it's not their fault. And, autism isn't a bad thing. I think there's a lot of stigma, but, the more we understand autism, the more public figures who are successful and brilliant and kind and creative, we have more examples of different things, famous, successful people with ADHD. I think our society is going in a positive direction in that sense. And the other thing that I like to remind families about the label fear, like I don't want my child to be labeled, I don't want their school or their teachers to treat them differently, is that these assessments are akin to medical records. They are private health information, so they are very, very protected legally, ethically. We have to, as psychologists, like be very, very careful about information, about software encryption. The levels of protection for this type of information are so significant that I think letting families know that this document and this information is your document and your information. I will share it with no one. I will not share it with your child's teacher. I will not share it with my colleagues. It's so private and confidential that like I could lose my license if I told anyone. Privacy and their confidentiality is so protected that I think that helps parents feel more comfortable that this isn't going to be posted on social media. Nobody's going to know unless a parent decides that they want to share this information with someone. So I think that helps parents say, okay, whatever comes out of this, if there is a label, if there is a diagnosis, it is their decision who they want to share that information with.
It puts them in the driver's seat, which is really important. I think they can otherwise that, oh, this is going to somehow spiral out of control and I won't be able to sort of like be like, again, that curator of how we all talk about it, how it rolls out, like, who knows and when. They actually have a lot more say in that. And legally, that's their right. And I think it's great to hear that. I think people need to hear that to understand. Speaking about the whole idea of like what we used to call it the fruit tree phenomenon, right? The apple doesn't fall far from the tree. And we say this lovingly. I have been noticing a lot of adults getting assessed in adulthood. And I know that Dr. Jessica, you've also assessed adults. I know other practitioners out there who assess adults. And one thing that I'm noticing happen, a trend, is that I have these clients who have a diagnosis, they start to see, like what Erin was saying, their kids are having similar characteristics and strengths and challenges. And there's the guilt, but there's also the curiosity of like, how can I possibly maybe do right by them by, maybe getting them assessed sooner and giving them a better chance, right, at success. And so I have a nuanced question that's pretty interesting. So this one comes from a parent from the community who would like to remain anonymous, but she says, it wasn't until I was in college that my learning and attention differences were documented. How different my experience might have been if they were identified earlier. And so she asks, my child is entering 3rd grade and seems to be doing fine in school, but should I consider testing to establish a baseline? In other words, should we test our kid because one of us has ADHD and a learning issue, or wait for problems to surface? And I want to go to Erin first this time. I'd love to hear your thoughts on this. And
yeah, this might be where Jessica and I's license and training is slightly different. My license as a licensed educational psychologist really, unfortunately, there needs to be a concern. I don't assess students out of curiosity. So there needs to be, as part of my licensing board, there needs to be an issue. And I do assess adults. So typically when I'm working with adults is something is impacting their job performance. So obviously with children, it's their access to school and their academic performance. But at least within kind of the purview of my license, I'm not really ethically allowed to just, let's see what we see. You know, there really needs to be an adverse impact, either within an academic or vocational setting. If a parent calls and says, I have ADHD, my husband has ADHD, I'm seeing some of the same symptoms in my child, they're distracted, they're hyperactive, then yes, absolutely, I'm your girl. But if we're just curious, that's not really within the scope of my license. So call Jessica for that one.
That is the benefit of private practice for me, because again, depending on, you know, kind of where you're going, like in a private practice situation, and I have my own practice, I have the beauty of being able to just investigate out of curiosity. But if a parent is curious, and I do have some of those evals come up, it could be just, I've had a few where it's like, hey, I'm homeschooling and I want to make sure I fully understand my kids' needs. Or, you know, hey, we're going to be making some school decisions or some move decisions in the future. I just want to know. So they are these more curious things, or I'm, you know, have ADHD. How's my kiddo doing in this area? But also, as part of that initial phone call, we'd have a discussion about like, okay, do you understand? Like, everything might just come back looking great, which is good. And that's good information to have. Or maybe we will find something, and just kind of being aware of all of the outcomes, because I never want a parent to come in for an evaluation and say, hey, that's not, this result isn't what I expected in terms of what I'm getting out of the evaluation. So if they're on that page and like, hey, I'm just curious, there's probably nothing, we can always look, and not necessarily, I would say, well, I guess it is kind of establishing a baseline, but just kind of checking to make sure everything looks okay in different areas. I also always tell people too, if you put any of us under a microscope, you might find some little differences. If I went through my own evaluations, anything with drawing and creating visually, not my jam. I would not do very well on them. It doesn't mean it's a diagnosis. It doesn't impact me in my everyday life, but we probably might find a few little things to work on or something like that. So you can do it out of curiosity. And then I also think it comes to the question of, you know, yes, I'm curious, and do I need this question answered for my own self? Like I need to just be like, okay, I want to check in. I want to make sure he's okay. That may be enough for you to go ahead and do the evaluation, because again, it should be an engaging experience for your child. But then again, I think the reality of life questions come in. Okay, finances, schedule, is this going to put stress on the family? Then maybe you wait a little bit. So those are all of those really personal decisions.
Absolutely. And I, you know, knowledge is power, and there's also life that we need to weigh.
Right.
Out. I guess I'm curious, is there a particular age by which you would say, if you've been curious, like when they hit this particular age or age band, like this makes the most sense for when to get an evaluation? Is there any, if you have any age specific advice? I think I've run into that question a lot from the folks that I've been coaching. It's like, well, now that my child is 3, now that my child is 6, now that my child is 9, now that my child is 12. And I think it kind of goes back to the, you know, you're probably never going to say, I wish I waited longer. But are there any like developmentally, like very significant, either for their, you know, biological development or their academic development, where you say, okay, if struggle's been happening, let's get this done? I'm curious what you would say, Dr. Jessica, and then we'll kick it back to Erin.
Yeah, I mean, kind of what Erin was saying before about having an impact. So I do feel like regardless of the age, I mean, I see kids who are 2 years old, if there's an impact socially, you know, we're not worried about academic impact at 2, but if you're looking at someone older, if you are feeling there's an academic impact, an impact within the family, an impact with friendships, then that would be a time, regardless of age, that I would at least have a conversation about an evaluation. Now, if your child's very young, for example, and you're worried about early reading, but you only want an evaluation to see if they're dyslexic, well, that's something that we would want to wait until they're a little bit older. But if they're young and you're like, hey, I just want to kind of see how they're doing in this area, maybe we can explore it. I would say, though, you know, one of the most common times I see kids who have not been evaluated before is kind of that middle school area, where you get a lot of just really, really bright kids who can compensate really well. And then middle school hits, and it's like changing classes and all of these demands. And it kind of goes from 0 to 60 in terms of expectations. And that, I would say, you know, I see people of all ages, and that is one of my biggest ages where I get referrals. Sometimes it's in anticipation of middle school. So it's like, hey, we're in 4th grade. I think I'm kind of seeing some flags here, and I want to make sure it's evaluated. Or we just started middle school and the wheels are falling off the bus very quickly, and we need to see what's going on. Another time period just to kind of be mindful of if you are looking at high stakes testing for your child. So this could be, ACT, SAT, even like IB or AP things. They will need, if you think they need accommodations, they will need a standardized evaluation that documents accommodations. And for little kids, maybe they had evaluation at 3 and they're often thriving, but you're thinking they're going to need accommodations. You're going to need to establish them ahead of time and make sure you're giving yourself enough time so you're not missing the very strict deadlines they have to get accommodations. Or when they're older, like they could be taking, we talked about law school earlier, the LSAT or something like that, you can still get accommodations. So there are these other timeframes too, just to kind of keep in the back of your mind. And maybe your child has been evaluated, but knowing like, hey, that might be another time point I need to pay attention to deadlines because it's actually going to serve a really clear purpose. Otherwise, I think it's just really, really dependent on kind of the question and the impact that you're seeing.
Are these deadlines standardized, like before, like they have to have established a certain amount of time? That's what I understand, but can you walk us through a little bit more about what that deadline would be? Let's say for thinking the big ones, the ACTs, the college entrance kind of exams. How many years prior would they have had to establish that they have a true need?
That's a great question. I think Erin can probably chime in on this one a lot too. So there are like published deadlines on the College Board website that will tell you by when you have to submit your evaluation documentation for a specific test date. So like if someone contacts me about ACT, SAT, whatever, I'm looking and see, okay, this year, what are the dates for different tests? And you have to have it submitted before that date to be considered for that test deadline. And then oftentimes they are looking for some sort of history of documented accommodations. There was a lot of scandal, varsity blue scandals and other things that came up because theoretically everyone could do better with extended time or some accommodations. But there are kids who truly need it. And so that is also something that I'll talk to parents about is you might be in a wonderful school that's informally accommodating your child, get it in writing. Because when it does come up to SAT accommodations, for example, they're going to look at, is there a history of the accommodation? If there isn't, it doesn't mean that you're not going to be able to get that accommodation, but kind of the bar at which they look at it is higher. And there are times when these accommodation requests absolutely get rejected. You can also go back to the psychologist and have them try to advocate on your behalf. So it's just something to kind of really be aware of. And every different test is going to have different deadlines depending on the year.
Thank you, Dr. Jessica. Yeah, Erin, what would you have to say about this piece?
I mean, Jessica nailed it. In terms of the high school student and testing accommodations, they have deadlines of when this assessment documentation needs to be submitted in order for the accommodation to be considered. And they do want a documented history of needing whatever type of accommodation you're advocating for, whether that's extended time. So I think a lot of parents sometimes, especially private school students, say, well, my students' teachers always just give them extra time. Well, it needs to be documented somewhere because the College Board gets a lot of these requests. And because of recent scandals, they really want to make sure that a student needs it and that there's evidence to support that through, prior accommodations and also assessment data. So that's a good heads up for parents to try to get their ducks in a row in that sense. And I think it's a timely conversation because during COVID, a lot of universities took these standardized testing requirements out of the picture in terms of admission requirements. And it seems like slowly more and more schools are now putting them back in. And there's, I've listened to a lot of podcasts as to why that is, and people have strong opinions for and against it. But the reality is those are coming back. They're mostly coming back at private, kind of like more elite universities. And I'm not sure if the UC system will adopt it. I know there was a big lawsuit, so they might be the last to put those back in the mix, but I think it's just a reality. I think that universities are trying to find ways to even the playing field and try to find some data in a student's application that is universal across students, across geographic areas, socioeconomic, just to have one universal data point. So I understand why they're doing it. It's not just to torture high school students, but I think that's a good thing for families to think about. And in terms of just what Jessica said about the kind of trajectory of students from elementary to middle school, I also get a lot of parents calling me 5th, 6th grade, because if you think about the executive functioning demands we place on 5th graders, one teacher, one classroom, at that point, they've typically been in this environment for more than 1 year, sometimes up to 6 years if they did TK. They're very comfortable, they're very supported, the teachers and staff know them really well and can support them. And then they go to middle school and they have 6 to 7 different classrooms, which means 6 to 7 different teachers, teaching styles, classroom expectations. They have lockers. Their stuff is in one place, but they need it in another place. They have to get all their stuff from their locker into their backpack back home to do their homework. And then they have to put all that stuff back. I mean, what we ask middle school and high schoolers to do in terms of their executive functioning, a lot of them are not developmentally ready to do. Even if your IQ is in the gifted range, if you can't organize yourself and your stuff, manage your time, you're going to fall apart. Even if you wrote the most beautiful essay, if it's on your desk at home and you forgot to put in your backpack to give to your teacher, you're not getting credit for it. So there is definitely this kind of drop off of, confidence and student success around middle school. And then again, at freshman year of high school, on purpose, schools are peeling back these levels of scaffolding and support for students. For a long time, your teacher is your executive functioning coach. And then they slowly expect you to be in the driver's seat of your organization and time management. And a lot of these kids do not have those skills or don't have those skills yet. So I also see a lot of students struggling with that. So a lot of families reach out like they did fine in elementary school and they got straight A's and they're really bright. And a lot of these students are really bright. Just because you're disorganized doesn't mean you're not bright. I think what we expect young people to be able to do, their brains are not developmentally ready to do a lot of the times.
Unfortunately, then the burden does end up landing on the student and the family to sort of like make up for that major transition. And so some of it is the system that they're in, but some of it, I would say that level of demand just will amplify already existing challenges. And that's what I was seeing in my own classroom, 1st through 3rd grade. It's like now we scaffolded to the most degree you could possibly scaffold. Like I differentiated even more than other Montessori teachers differentiated. And we could still see the difference though, if a 3rd grader was not yet able to read on their own, to do their own research, for example, or form words comfortably with their own pencil and hand, right, to get their ideas down. And that's where we started really getting curious and wanting to even possibly bring in accommodations and targeted therapy, because we knew that like the demands were only going to stack from there, especially reading and writing. And also obviously organizing, executive functioning, the big dropping between 5th, 6th, 7th grade in that area. But even as early as 4th grade, there's a higher demand on kids to manage themselves and manage their work. So that's where I started to see the most, I would say, is probably like behaviorally right at 6 when they came in and saying, wow, things that we thought we'd grow out of by now are not, it's not happening. And then as we're heading into like 8, 9, 3rd grade, where some of the more learning based challenges are starting to really impact their ability to participate in school meaningfully. So in a way we're saying like, oh, kind of the whole time, but there are these like there's these specific times though that like demand goes up and it's a magnifier on whatever challenges already exist. And that's when kids can start to have those, adverse reactions to school, feel more stressed, underperform, etc. And it really catches our attention. Thank you for answering that question. I know it's a really nuanced one, but people really want to know more about. And I want to close us out with our last listener question from Emma F., who lives in Seattle. She lives in a big city where there are a lot of professional assessors. How do you suggest parents figure out who to hire? And I'd love to hear from you first, Dr. Jessica, this one.
It can be really overwhelming to try to find an evaluator for your child. And I think one of the things is to first seek out referrals or ask people that you know. So maybe your child has been in speech therapy before, occupational therapy. They probably have people that they've referred to. If you have a good relationship with your child's teacher, or maybe they're getting support from school, oftentimes they can at least get you in the direction of people that they have worked with before and know are good professionals who can meet your needs. If there's local parent groups, like if you're on Facebook or things like that, oftentimes you'll find really, really good resources in that too. And then just kind of doing your own kind of Google search. You could also look on things like Psychology Today. Some assessors are on there, but not everyone, to try to find someone in your community and kind of look at their website and see if how they're talking about things and how they're talking about their approach jives with your family. no matter what, even if you get a referral and they're like, hey, it could be me. They could say, I want you to go and see Dr. Jessica. Well, you know what? You should talk to me. You should talk to 3 or 4 other people and ask them the same questions and kind of decide what you want to get out of the evaluation and make sure you're kind of articulating that really quickly. Not quickly, really clearly to them. Or if there's things that you want to make sure are covered, if you want to know what their approach is, like how many sessions, logistics of timing, where are they going to see the child? How do they work with kids if they are more hesitant or are really resistant? How do they get feedback to the family, to the kids? So kind of decide, everyone's going to have different things as to what like their most important thing is as a family, and then kind of come up with a list of questions and then ask the providers and see who feels like a good fit. And there's also going to be differences in the responses. Sometimes you'll be talking directly to the provider. Sometimes you're never going to talk to the provider. You're going to be talking to an administrative assistant, which is not necessarily a bad thing, but just making sure you get a really good feel for them. Also with evaluations, you might be working directly with the psychologist you spoke to. You might be working with someone who works under them. So really making sure that that's clear. I think one of the biggest things that I see for parents who have had an evaluation and then come to me because maybe they want another opinion or they feel like something was missing is that they went into the evaluation kind of based on a recommendation, but the scope of what that evaluator looked at, they might have been fabulous, wasn't fully the scope that they were hoping that it would cover. And so, maybe that parent was suspecting autism with their child, but they focused on like learning ADHD because autism isn't their area of specialty. That may not be with the evaluator, but maybe that parent didn't articulate it and just thought that everything would be covered. There are also times when parents have very specific questions like, you know what, I just think my child is a little bit behind in reading, not worried about anything else. I just want someone to do kind of a screener for dyslexia. And then you want to find someone who's doing a screener for dyslexia and not doing maybe more of the comprehensive evaluation. So kind of really thinking about the outcome that you hope to have so you can ask those questions is going to be really important.
Thank you, Dr. Jessica. Erin, do you have anything to add?
No, I think that was really comprehensive. Thinking from the perspective of someone on the receiving end of people seeking out assessments, that is where a lot of folks find me. It's a lot of word of mouth. It's a service that we're providing. It's a product, but it's also really a service. And it involves a tremendous amount of trust, as we've previously discussed. Like you're giving your sweet little baby to someone and putting them in an unfamiliar environment, and the stakes are very high. I think definitely talk to other people in your network, in your community that have had positive experiences and get some names from them. But yeah, Jessica made a great suggestion. Talk to a few folks. A lot of it is going to be fit. Do you like their style? Do you feel a connection to the provider? A lot of us use the same tools. A lot of it's pretty standard. A lot of that is pretty uniform to anyone who does this work, but not everyone goes about it in the same way. Not everyone's style is the same. So I think it's really important to feel a good personality fit with the provider and ask really good questions. Like, how long are your reports typically? What types of recommendations do you include? Is it just for the school? Is it for other professionals? How long does this process take? What does my child need to bring? How much is this going to cost? What can I do with this report? That's, I think, a big area that I like to spend some time on when I do intakes with families is to make sure that they know that if they are looking for school-based services, especially if it's a public school student, that outside assessments are not your one-way ticket to an IEP. I think that's a huge misconception with a lot of families. So I always want to make sure if I'm working with a public school student that the family knows that this is not going to get you necessarily what you want if that is your objective. What school districts are legally required to do is to consider an outside assessment, and they do, but sometimes that leads to an IEP. Sometimes that leads to the school doing additional testing if they want more information or they want a little bit of their own data. Sometimes it doesn't lead to an IEP. And the last thing I want is for families to think they've taken the time, maybe they've incurred some personal expense, thinking, okay, I'm going to bring this report to my child's school and they will hand me an IEP. And that's not how it works. And I don't want them to have that expectation and be disappointed. So I try to be really transparent about that. Coming from the school system, that's one thing that I can offer families is like, be very, very clear about what to expect and what not to expect if they're trying to get their child services within a school. So I think that's really important, because the last thing I would want is for families to take the time out of their busy schedules and to bring their child to my office to do all this testing and then think, okay, I'm just going to hand this document over and I'm going to get this beautiful IEP and these services. That's not always how it works. So I want them to know that before they start the process.
Thank you. Yeah. And that
Yeah.
honesty of like, just like putting that straight in the front of the conversation. So there are expectations, a match with reality. And then also, I know you don't leave them hanging. Either of you do. Like if IEP is what they're pursuing, I know you have a lot of pointers and tips, and either of yourself or others that can advocate through them, to help them through that process. I have someone on my team, for example, who will sit in an IEP meetings, who's an OT, and she also is just passionate about like kids who really should be qualifying for services, getting those services. And so I know both of you lay on that end of the spectrum too, but to manage their expectations, that a piece of paper is not the same as like a full advocacy process.
I wish it
And
was that easy.
I do too.
I
I really
know.
wish you could like submit it to some cloud-based bank and they're like, they go check and like, okay, now you get the service. That would be amazing. Unfortunately, the burden again lands on families quite a bit and the external professionals. I do want to mention one thing too that I've had people do is ask for a sample report of what you can expect to get on the other side. Obviously, all confidential information is removed, or they might even do a mock-up where it's not a real person, but that way the parents can actually get a concrete example of like what they could expect to have in hand at the end of the process. And that has been wildly helpful too for folks. So it's something you can ask about. It's not always available, but sometimes that can help if there's a sample. And I want to make sure that we have time for this last important question for both of you, which is something I ask all my guests. And it's sort of a moment to reflect. Like if you could go back to the very beginning of parenting, especially since you're both parents, and you had the opportunity to say one thing to yourself, like kind of like lean in and whisper one thing into your own ear about being a parent, what would it be and why?
Oh, that's a good one. I think my parenting experience is especially unique because I have identical twins. So that's like a science experiment in itself because they're genetically identical, even though they're very different personalities. I try to use my professional knowledge to be a good parent, but I mean, we're all human. I think the one thing I've learned is that the power of, and I'm sorry, I'm a human being. I have stressful days. I lose my temper. We all try to be the best parents we could be because we love our children so much. And sometimes we screw up. Sometimes we're short tempered. Sometimes we lose our cool. Sometimes we jump to conclusions. And my style of parenting is I think the power of an apology goes so far. I will apologize to my kids if I've screwed up, if I was snappy, if I lost my cool, if I was impatient. These are all things we experience as human beings. The reaction I get when I tell my kids, you know what, I'm really sorry. I should have not said that, or I should have done this differently, I think is a really powerful moment of reconnection. It, kind of reestablishes that bond. And it also is a model for them to see, I'm not perfect. They're not perfect. It gives them permission as little humans themselves to see, okay, everyone makes mistakes. Even mom makes mistakes. Even dad makes mistakes. And I care about you enough to acknowledge that and to try to reconnect with you.
I love it. Thank you, Erin. I felt your heart in it. I had to put my hand on my heart the moment. It was like, oh, and thinking back on all the times that would have had an impact, is even on us as young people, if those adults like in our lives could have leaned into those apologies a bit more. Yeah. So happy for your little ones that they get to have this version of a mom. It's awesome. Jessica, how about for you?
That's a great question. I think like just realizing like how little I actually knew, even though, I have a doctorate in psychology and have all these years in working with kids, and like I didn't even know what I didn't know about parenting. So we have all of these tools and tricks, and I knew them from like graduate school and working with kids. And then my first child just threw all of those out the window, and they did not work for him. And now I have 3 other kids, and something different works for each one of them. And just really making sure that we're focusing on like who your child is and like their individual needs and their individual strengths, and kind of not necessarily worrying, like not necessarily throwing it out the window, but just, like we do get very focused on like, oh, comparing them to other kids, which, is kind of funny when we kind of talk about evaluations, or how are they fitting in this way? And it's like, no, looking at who your child is, what are their interests, really focusing on their strengths and seeing them for who they are and not trying to change who they are, trying to support who they are, just in general, I think is one of the most powerful things that kind of shapes my view as a parent.
I couldn't agree more with both of what you just shared. I mean, we even have whole months dedicated to conflict resolution and repair and how to do that well as a family for a reason. And we have, constantly talking about like, we're not giving you a method. We're not giving you, a way. We're giving you a toolbox so that you can customize it and find your own authentic parenting style that works for you, but also works for each of your kids, because they're going to need different things. And that's, yeah, I just love the way you said it, Dr. Jessica. Thank you. So much wisdom today in this podcast interview. So happy to have had both of you. And, Erin and Jessica love hearing from people. They both have websites as well that you can check out. If you want to find Dr. Jessica, her website is www.dr. Jessica, Jessica, Snowden, Snowden, Patel, Patel. So it's Dr. Jessica Snowden Patel.com. And Erin's is www.empowered-psych, as in psych.com. So please check them out. You can also see their contact info in the show notes of the episode on all the platforms, and be in touch, reach out. They would love to hear from you and for you to check out what their work is, and recommend to your friends as well. Clearly there's a reason I know dozens, maybe even over 100 practitioners that I'm connected with, and it's no mistake that I chose these two esteemed colleagues to bring on to the podcast today. They do stellar work, and the kind of work that I can stand behind and recommend my dearest people to. So please check them out and consider them for you and your communities. And thank you so much for sharing your wisdom today, Erin, Jessica. It was a pleasure to have you.
Thank you for having us.
Thank you.
As we wrap up, remember, there's no one-size-fits-all way to parent. Keep nurturing those strong family bonds and watch resilience bloom in your community. You've got this. And if you found this episode valuable, don't forget to like, share, and subscribe. You can also hop over to thecalmempoweredparent.com for current events and to grab your copy of the Calm Parent Strategy Guide. You can even learn how to bring our free and low-cost workshops to your school or community. Your support means the world to us and helps us empower more parents and children. Let's do this together.